So one of the most common and effective diets is what we call the gluten and casein-free diet, or as we refer to it as GFCF. This is removing the gluten, which is the protein in wheat, dairy, rye, spelt and kamut, as well as commercial oats, and removing casein, which is the protein in dairy. And these foods can be very inflammatory to the gut. These are called, the reaction that's happening is what we call a food sensitivity. This is different than a food allergy. So when you go to a physician and they do a food allergy test like a skin prick test, that's going to test for things like rashes, hives, anaphylaxis. What we're talking here is by introducing removing these foods, we're addressing food sensitivities, which have more chronic symptoms such as inflammation in the gut and challenges around the immune system and attention and digestion. So what happens with these proteins is that they inhibit digestive function by causing so much inflammation, and they also create opiates in certain cases where these proteins can't get broken down properly. And what happens when you have this inflammation is that it can lead to decreased nutrient absorption and nutrient deficiencies, which are so common in childhood illnesses today. Those opiates that can get created are very addictive, and as you can imagine, what they can do is they can create a host of inattentiveness. If you think of opiates such as things like morphine, what happens? You get foggy thinking, spaciness, inattentive, as well as constipation and other conditions like that. So when you have a combination of all of this, what happens is that you feed the nutrient deficiency, or I guess would say, you increase the nutrient deficiencies because you can't absorb the foods that they're eating. And often the diet is so limited already that whatever small nutrients that are there don't get absorbed as they should. One of the key things to this diet is to really be 100% with it. You want to make sure that you get 100% of the gluten and the casein out. And that's really important, to find a good resource where you can figure out what all those hidden sources are. And give it a good chance. Give it a good 3 to 6 months, because it takes quite a while for these antibodies and these reactions to get out of the system. Some of the most common improvements that we really see in this diet, particularly, one of the most common things I see is in digestion. Digestion around diarrhea improving, constipation, gut pain, improvements also in other things like language. That's a huge one I often see with GFCF. Things like, if you can imagine, attention improving and your ability to focus, you're going to learn so much more. And I often hear when I go places that parents tell me an increase in language is one of the most immediate things they see. But also regulation of energy, so fatigue or hyperactivity balancing out, mood improving, as well as just overall general happiness and sense of the child also improves with this diet. So it's really a wonderful place to start. It's not a difficult diet to do. It just takes a little bit of practice to figure out what are good substitutes. And when you make substitutions, you want to make sure not to add too much junk food in. Try to keep the diet as healthy as possible. But GFCF is a great way to go.